This is a Jet 24, Fox 66, your Erie.com special report.
Good afternoon. We interrupt our regular programming to bring you a special report this afternoon, an update on the spread of COVID-19 in Erie County. This is, of course, the first briefing since Erie County entered the green phase last Friday. We go live now to the studios of WQLN and County Executive Kathy Dahlkemper.
Good afternoon, and thank you for joining me here on this first day of July as we give you an update on COVID-19 in Erie County. We have 12 new cases of COVID-19 to report in Erie County as of 12:01 a.m. for a total of 620 cumulative positive cases. We currently have 493 recovered cases, which leaves us with 113 active cases, 11,676 negative cases, and a total of 14 deaths. Of the cumulative cases in Erie, 58% are female and 42% are male. The breakdown in terms of age is 3% are the 0 to 4 years old, 2% 5 to 9, 6% are ages 10 to 18, 15% ages 19 to 24, 41% ages 25 to 49, 21% ages 50 to 64, and 13% are ages 65 and older. Again, please remember that our percentage values may not always total 100 as we are rounding. Regarding race and ethnicity of our total cases, 49% are white residents, 35% are African American or black residents, 4% are Asian, 2% are other, and 10% are unknown. Regarding Hispanic origin, 11% are Hispanic of any race and 75% are non-Hispanic, and 13% are unknown. Since we moved into the green phase last Friday, I would like to commend our residents and especially our businesses for doing a great job overall. But please understand that this virus is still with us, still looking for its next host. We cannot forget that. And the last thing we want to have to do is to shut down our county again, like some other counties are doing, or even partially shutting it down. So we must continue to wear our masks and physically distance ourselves and practice good hygiene and stay away from anyone who's ill. Now, I understand that people have very strong feelings about masks, but the truth is wearing a mask does, in fact, protect others from your droplets. I think we want our kids to be able to return to school, and we want our businesses to remain open, and we want to return to our places of worship. We want this virus to disappear. So I urge everyone, as we approach the 4th of July weekend, to do your patriotic duty and wear your mask when you are near anyone who does not live with you inside of your home, even when you're outside. And my understanding is that today an executive order from the governor's office was signed that is going to make it mandatory, with law enforcement being able to enforce mask wearing when you are in any public space, indoors or outdoors, and unable to social distance from someone you don't live with. We also know states such as New York are requiring visitors from 16 other states to self-quarantine for 14 days if they enter New York State. Of course, Pennsylvania has the potential to do the same as well, but we hope that that does not happen. And what that's going to take is all of us working together to keep our numbers lower in Pennsylvania. Governor Wolf today reminded everyone of the requirements at restaurants and bars to keep employees and patrons safe from COVID-19. So remember that you're not only keeping yourself safe, but those who are serving you, you're helping to keep safe. Some examples that the governor put forward today are that all customers are required to wear their masks while entering, exiting, and traveling anywhere within that food service facility. And you can remove your mask when seated. There needs to be at least 6 foot between tables of people, or physical barriers must be in place. No business is required to conduct in-person operations and should not do so if they're unable to follow the guidelines, and now actually the mandate put out by the governor. And that brings me to today's star players, those businesses that we have had reports of, we have seen through our inspectors that are doing so well. First, Serendipity Suites on East 38th Street. They have signs on their doors requiring masking with sanitizer when you walk in, and customers asked to sanitize their hands prior to entering. The staff hands out frozen yogurt cups and spoons, and they wipe down each handle of the frozen yogurt machines after each person or family uses it. They have toppings in individual prepackaged plastic containers versus one communal container, and that reduces the amount of touch surfaces. You can still order online there and pay online, and they'll bring it out to you if you would like that curbside pickup to be even safer. Macy's at the Mill Creek Mall is also doing a very good job. As we know, the mall reopened last Friday. Signs are at the Macy's requiring masks, social distancing, general health reminders, and more, and they're very visible. And we know in the sunglass area, if people put sunglasses on to try them, they are then put into a special tray where they are sanitized by employees. And most of the fitting rooms are closed. They have racks for clothing returns, so after you've tried on a shirt, you put it on that rack, and the staff then will leave it on there for 3 days. They also have put the shields at the registers to leave that distance between you and the employee. And they are still offering also curbside pickup if you would like to order online. Employees in the store were seen to be very proactive, communicating with their customers, even reminding customers that their mask not only needs to cover your mouth, but needs to cover your nose also. Round one in the Mill Creek Mall, another Mill Creek Mall store or entity that's doing well. Employees are posted at both the exterior and concourse entrances to ensure mask usage and to check the temperature of all the visitors. Multiple gaming machines are closed for social distancing, and cleaning stickers are placed on the machines, and users are instructed to remove the sticker after using the machine so that the employees can then go back and sanitize the used machine. And Mad Mex at the Mill Creek Mall has a sign posted saying no mask, no service. Finally, Ambridge Rose Spa and Salon out on West 26th Street has been working pretty much since the day they closed down to safely reopen. They're glad to be reopened, but they put in many, many safety procedures, including even creating a mask that doesn't have any straps on it, but tapes to your face so that when you're having a haircut, you can still get your haircut the way you want, but you will be safely masked up. So thank you to all of these star players and to all of our businesses and restaurants who are working so hard to follow the guidelines to keep everyone in our community safe. Once again, I ask you to please consider the risks involved with each decision that you make as you leave your home and determine if those risks are worth it. And do not go anywhere that makes you feel uncomfortable. I see so many crowds of people gathered and no one wearing a mask. Please think about others. Even if you feel healthy, you could be carrying the virus. Even if you feel healthy, people around you could be carrying the virus. And even if you feel healthy and don't like to wear a mask or don't think you need to, that simple task of putting on a mask could save someone else's life. And now I'd like to invite Melissa Lyon, the Director of the Erie County Department of Health, to share an update from the Health Department. Melissa?
Thank you, County Executives. It's a pleasure to join you today. So my comments will be short, but I did want to start out commending the community, as you have done as well, for the work that they've been doing to keep our new cases of COVID-19 manageable. And the example that I'm going to give is we are 10 days past Father's Day, and we've not seen a spike in case numbers related to Father's Day celebration. We know that disease can still show up in 14 days, but so far this is incredibly promising. That is an encouraging sign that people are practicing social distancing and universal masking when they're celebrating, as well as good hygiene. We thank you for your earnest efforts to stop the spread of disease. So with the 4th of July upon us, we want to stress the importance of celebrating this holiday responsibly. A friend and a colleague had recently said that COVID-19 is a social infection. The virus takes advantage of human socialization. We need that. We desire that. That's what makes us human. So the more we socialize, the more we're going to increase our risk of exposure to the virus. So when you're celebrating the 4th of July this year, we just ask that you should try to plan your social events to be smaller gatherings where you can still socialize but minimize your risk. Prepare to wear a mask and request that others do the same. And when possible, practice social distancing and prepare to be outside as much as possible. But I would be remiss if I don't mention the weather report because it's expected to be hot and sunny. So if you're outside, please don't forget to stay hydrated and drink water and wear your sunscreen. Thank you. Back to you.
Thank you, Director Lyon, and thanks for all of those great health tips. Now I'm going to open it up to the press for questions, and we're going to start today with Erie News Now.
Hi, good afternoon. Question for you here. We see where Governor Wolf has pretty well said that he's not looking to really do statewide shutdowns and is probably going to hand things more and more off to local governments. So your thoughts on that, of really being in control of what happens here in the county?
Well, we've seen all along during this COVID pandemic that the conditions across this Commonwealth have been very different. We know that the Southeast was hit much harder than the Northwest was. Even as we were moving from the red phase to the yellow to the green, you know, we saw that we were more aligned with those in the West and those in the North than we were in the Southeast in particular. So I think there's certainly some benefit with not treating the state altogether when you look at potentially having to backpedal and dial down.
And do you feel that that the county as a whole is prepared to handle this situation on its own without that helping hand there from Harrisburg, without that leadership from Harrisburg?
Well, obviously, we continue to work very, very closely with the Pennsylvania Department of Health and with Governor Wolf's administration in total, and we would always be looking to them for guidance and having discussions with them as we would look to change anything. And I'm going to ask Director Lyon if she wants to make any further comments, maybe around that relationship and how we would handle that.
Yeah, thank you, County Executive. The piece that I would add in is even as early as today, I was on a call with the State Health Department. All of the county municipal health departments participated in that call, and we talked about what's happening in Allegheny County and them having to dial down a bit on the things that they've opened. And the State Health Department was working directly with the Public Health Director on that decision making. And so I'm confident that the same thing would be offered to Erie County if we needed to make any changes to our processes. Thank you.
And Director, are you glad for that autonomy to have the state help if needed, but to be able to make the call on the ground here?
Yeah, so the Erie County Department of Health and the other 9 county municipal health departments throughout the Commonwealth have had that autonomy right along. So it does feel nice that there would be support and leadership in the decision making, taking a deeper dive into our situations and talking it through, and also learning from our colleagues such as Allegheny County and those others that may be experiencing upticks in cases as we continue to move forward in the green phase. So yes, I am grateful for the autonomy, but also the support.
Thank you. Jet TV.
Good afternoon, Kathy. This is Farah Bodie. Obviously, we're entering a huge holiday weekend, and in the green phase, a lot of people are going to possibly attract to coming to Presque Isle, Waldameer during the holiday weekend from the tri-state area. What are your thoughts going into this weekend, knowing that other people could potentially be coming into our area?
Well, again, I would hope that people would stay close to home and have a staycation. I mean, I know that many of our businesses may think differently about that because they depend on these vacationers to come here and support, whether it's their hotels, the restaurants, all of those type of things. But with the state really mandating that everywhere you have to wear masks, I think that will be helpful for us because we know we get a lot of visitors who are from Pennsylvania, but from places further south, Allegheny County and many places in between. So if the whole state is united on this mask wearing, that is going to bode well, I think, for them understanding when they come here that nothing has changed in terms of that guidance, where I think we've maybe been stronger on that guidance here in Erie County than some other counties have. And Ashtabula, Chautauqua, and those places to the east and to the west, hopefully they would also understand the importance of this. I think it's been a real wake-up to the whole country to see what's going on in many of our states to the south and also what's going on in Allegheny County right now. And so hopefully that will help people to understand that these guidances we have in place are for everyone's good, and that they, no matter where they travel, that they will follow that guidance.
Thank you.
Erie Times News.
Hi, Kathy. It's Matt Rink. Wanted to talk a little bit about early June. You had called for Erie County to go green. Obviously, that did not happen until last Friday. Knowing what you know now, do you still believe Erie County could have transitioned to the green phase earlier than what it did?
Well, I think we could have. You know, again, I mentioned so many businesses today that are doing just a phenomenal job, and that's what we've seen pretty consistently, is that our businesses really want to help us control the spread, and they don't want COVID-19 to affect themselves, their employees, or their customers. So when people go into businesses, they have to wear masks, and that is different than when they're out and maybe in other public places that aren't a private business. And so that's why I felt moving to the green would actually maybe even help people to become more accustomed to wearing a mask, and to make this more a part of their habits. And that's what I think that the businesses are helping us do. So I still believe we were ready, but you know, we went green when we did, so we can't go back and change that.
You obviously talked about a lot of the businesses that are doing good work in terms of the social distancing and requiring masks and all those other things. Are there any businesses, just in general, that need to do a little bit of work on following all these guidelines?
Yes, there are, and I get personally people sending me things about businesses pretty much every day. Other elected officials send me things that they get notices on. Our health department, you know, you can always call the 451-6700 number, and they get calls there. And what we do, again, to try to be partners with our businesses, we don't want to be punitive. We're trying to be partners. We make a phone call. We talk to that business, explain the concerns that have been brought forward by some resident of Erie County, and try to see what we can do to help them follow the guidance. And I also will say that myself personally, I was in a business about a week ago, and when I walked in, I said something to the cashier checking me out. You know, there's a lot of people in the store not wearing a mask, and the cashier said, I tell them to, and they refuse. And that's where I think the bigger issue is. And so I ask everyone listening to please remember that you are, when you say no to these cashiers who are the employees of these stores, you're putting them in a very, very difficult situation, and I ask you to comply. I think that's maybe the bigger sense, is that all of us need to be understanding of the employees and what they're trying to do.
Okay, very good.
Sure. Talk Erie?
Yes, hi Kathy, it's Joel Natale. Good afternoon. Just to follow up on the holiday, are there any specific enforcement protocols at the county level that you are planning on engaging to manage all the visitors coming to Erie County this weekend?
I'm going to let Melissa talk about sort of the enforcement and what we're doing right now through the County Department of Health, if Melissa could take that.
Sure. Primarily, we have not designed a more robust strategy for the holiday weekend. We get most of the complaints come in through our emails and our hotline number, and we're following up with those as we typically do, as County Executive explained. We do have a 24/7 hotline, and it's manned by a live answering service. And they have a triage process that they use to identify, is this a priority call that needs to be directed to a supervisor immediately and taken care of after hours, or if it is something that can wait until the following business day. So to answer your question, Joel, there is not a more robust strategy. We're going to do business as normal, but I believe that our systems work very effectively and efficiently, and we have people on call for the weekend.
Do you think that you'll kind of keep an eye on places that are naturally areas that people will congregate?
We typically do surveillance in areas of either trending to get the most number of calls where we see that there could be problems and or areas that may be congregating. So we have been doing some surveillance, and then we build our work strategy around the results of that surveillance.
Thanks.
Thanks, Joel. Erie News Now, Ethan?
Hi, fingers crossed it doesn't come to this, but what are the parameters that you'd use? What are the metrics you're looking at which point you would say you'd need to start rolling back some of the restrictions that were loosened? You know, at what point would you say we need to start tightening these here in Erie County?
Yes, I'm going to have Melissa Lyon take that first, please.
Thank you for asking that question, and I was anticipating that might be asked today. And so the particular metrics that Allegheny has been using and the state helped them transition through to determine to dial back some of their operations. I don't have those at my fingertips, but I did reach out to my colleague to ask if they would share what they were looking at. Were they asking specific questions during disease investigation? Are they collecting data that maybe were not? So on and so forth. So I don't have a solid answer for you, other than we did change our disease investigation form to include things along the lines when we're asking the questioning, you know, have you been at a crowded bar? Were you out at a large gathering? We hadn't been asking that specific of a question, so now we're going to trigger some responses around that. So that might be helpful as we move forward. I hope that answers the question to the best of my ability.
Sure. So right now there's no hard and fast rules of if we hit X, Y, or Z, we shut back down. That's still kind of in the works?
That's correct. I mean, I suspect the State Health Department would be very concerned about the increased number of cases if we were to experience that, and I'm confident that would be a trigger point. But what other type of data would be reviewing to determine how we would dial back? Because it doesn't make sense to just start closing things down without having good supportive reason why you're choosing and picking certain businesses or activities. So it really is going to need a deeper dive into the weeds before we would do that or feel comfortable doing that.
Thanks.
Jet TV star.
Hi, Kathy. In regards to the tourism weekend, again, have you guys been in contact with tourism places like hotels and ways to strategize for the big holiday weekend and what you guys are doing to ensure that people are staying safe if they're staying over?
So our environmental team has been working with all of those entities all along as they were getting ready to open up. And so the guidance is out there. The guidance, we're always there to answer their questions and to help them, you know, navigate through this. But again, what we've seen is that the businesses are really working very diligently to try to keep their business safe. And I think any business owner would not want their business on the front page saying it had to close because there was an outbreak of COVID-19 there. So that's an incentive for each business owner to do the right thing, and they have been working diligently with our environmental team to do that.
Thanks.
Erie Times News.
You know, I know there are a lot of school districts right now that are in the planning process for the fall on what school will look like for the students when they go back. Can you talk a little bit about what role the health department might be playing in that process and what advice you guys are giving to school districts?
Sure. You know, I just got off a call actually with the County Association of Pennsylvania where they asked me to speak to what we were doing here in Erie County along with one other county in the southeast because we do have a fairly robust dialogue going on with our school districts. And so we started that when they first had to close down and then as they looked at graduation and end of year celebrations. And so a team from the health department, particularly the environmental division, as well as staff from the emergency management out of public safety who works with schools all the time on their school safety plans. They are working collectively with each of the schools. So we have 13 school districts, and so they meet regularly, the superintendent, so that's been a good way to communicate. We are reviewing all of their plans and then giving them constructive ideas on how maybe they can improve their plan and refine it a bit, knowing that each school is different. Their footprint is different, their school body is different, their resources are different, so we try to work with each of them. But it's important for everyone to realize in the end of the day that we are separate government entities. We don't control the school districts, but we are partnering with them, and in the end of the day, it will be up to each superintendent and their school board to decide how they move things forward. But in the midst of all this, it became very apparent that we were missing out on a whole other sector of our school students. That would be those who go to Catholic schools, Christian schools, academies, charter schools. And so the IU intermediate unit has been helping us gather the names and connections for all of those schools, and we are also doing the same with them and trying to work with all of our school districts so that our children are as safe as they can be when they go back to school in the fall. And then we're going to do a training to also help the schools, first of all, with kind of this general guidance that comes from the CDC, that comes from the Pennsylvania Department of Health and our local Department of Health. And then there'll be a clinical piece on that too, where you've all met Shar Behringer. She's been on here before, and I think it's Shar who's going to do this, but she's going to explain, like, what is isolation and quarantine? What does a contact tracer do? Schools need to keep good records about where students are sitting, whether they're in the school classroom or on a bus or whatever, so that in case someone does get positive, they can tell us this is who that student was around. So actually, it's quite robust work going on. It's a lot of work. And again, my team has jumped up and said, we'll do it. The health department, as always, says we'll find a way to do this and to support our community. So yeah, there's a lot going on there that's important. I don't know if Melissa has anything to add to that.
I don't have anything to add. You touched on the training.
Okay, great.
Okay, thank you.
Sure. Talk Erie?
Yes, hi, Kathy. Just to follow up on Matthew's question, what is your reaction to the American Academy of Pediatrics recommending that students do in-person school this fall? They're really pushing that forward.
Well, you know, I think there's a multiple things to think about here. As Melissa said, we are social beings. Many students learn better and have a more robust education. I would say probably the vast majority of them when they're in a classroom setting with a teacher and their fellow students to, you know, work things through. But, excuse me. So I think that that's important. We have to, though, do it safely, and there is always that risk. But we have to learn how to live with COVID-19. All experts basically are saying it will be with us for probably a minimum of 12 more months. It could be much longer than that. We hope not. So we have to find ways to learn to live with COVID-19, and that would include finding safe ways for our children to go back to school. And so that's why we're important that we work with them.
So you would advocate for a bias toward in-person because of all the benefits of the education piece?
Oh, yes, I would. And, you know, even having talked to some of the teachers out there, how difficult it is to do, even though they're doing a great job and working as hard as they can to do it, the online schooling is a very difficult thing to do with those large numbers of students. And so I think there's just a lot of challenges that have to be done whether we go back to school or not. But I think there always needs to be a contingency plan, because if suddenly you have just a lot of contagion and the virus spreading rapidly through the school, they're going to have to probably shut down, and so the schools have to be ready for both. So above and beyond everything else we're putting on, then we're putting this kind of safety with a virus and a pandemic on our school systems and our school teachers, and I don't think we can thank them enough for everything they're doing. But I would say that I also believe that we have to find a way to get them back into school.
Thank you.
Mm-hmm. Erie News Now, do you have any final question?
One last one for you. Now, although you seem relatively encouraged by how we're doing so far, what is your single biggest fear at the moment here as this progresses and as we kind of ease our way into the green phase?
My single biggest fear is that people don't put on their masks. So I've got my mask for every occasion. This is my mask for the celebration of our country and 4th of July. But so many people think they don't have to wear these, that there's no reason to wear them, and the virus is continuing to spread. So my biggest fear is that people will not take the guidelines seriously of wearing a mask, social distancing, staying away from people that are sick, and washing their hands frequently, good personal hygiene. It's things we've been talking about for many, many months now, but I think with the green phase, too many people thought, well, green means go and it's all over. It's far from over. As I said, the virus is still here looking for its next host. Thank you. Jet TV, Star, do you have any final question?
Yes, Kathy. Advice for restaurant owners and hotel owners this weekend, even retail owners, as we move further into the green phase and into this big holiday weekend.
Well, my advice is to make sure that you do everything you can in your power to keep your business as safe as possible. Enforce the guidelines for those coming into your store, to your hotel, to your restaurant. Don't be afraid to require people to wear masks, just as you wouldn't let someone come into your restaurant who's shirtless and shoeless. Don't let them come in without a mask. It should be the same criteria. And, you know, change is hard, but I ask them all to be strong in terms of enforcement.
All right, thank you.
Erie Times News. Matt, do you have any final question?
No final questions, Kathy. Thank you.
Okay, Joel, you have the final one if you have one.
I do, and this one is for Melissa. Melissa, can you explain what the science is behind stopping only alcohol service at the bars and restaurants in Allegheny County? Did they give you any clue of why that was the trigger by the State Health Department?
Thank you for the question, and we've discussed this frequently at our morning briefings with colleagues that have had some experience and been doing a bit of review. And the more that we consume alcohol and maybe consume more than is appropriate for an evening, we tend to lower our inhibitions, and that would entail we tend to talk louder, we tend to shout, we tend to want to get, boisterous. We have more personal contact, and that draws large crowds as well. That social interaction, we're very drawn to that. And so the belief is that by having alcohol served, people are lowering their inhibitions. They tend to be not wearing their mask as you're drinking frequently. It's not that the meal's over and you've then put your mask back on. You're continuing to be unmasked throughout that process. So I think it's a combination of things, being close together, being boisterous and speaking loudly. Sometimes it results in loud singing, right? And we all know that projects more droplets in a setting. So I believe that to be the reason that alcohol was prohibited in those establishments.
Thanks for that explanation. I appreciate it.
Thank you, Joel, and thank you, Melissa, for being with us again. Always a great wealth of information, and I really appreciate her being on. And thank you to our media. I do want to talk census numbers since we are a week from last report, but unfortunately we're still at 69% of households in Erie County and 61% in the city, so we've seen very little movement this week. So please promote the census to your family, friends, and neighbors. As we're getting money in to fight COVID-19 in this community, it's based on our census numbers. So if we don't have people counted, any future pandemic, lots of future funding in all sorts of areas will not come to Erie County if we're not correctly counted. So please remember that you will be seeing, if you haven't reported, you will be seeing people probably at your door, but you can always go on to my2020census.gov today. It takes less than 10 minutes to fill out your census. It's not hard to do. You can call 844-330-2020, and you should have received something in the mail that you would have all that information on also. And then finally, as we continue into this holiday weekend, as we operate in the green phase, I ask you again to just please do your best. Do your best to wear your mask. I'm going to put my mask on in honor of our country and the celebration of 4th of July coming up, but I ask you to wear your mask. Make sure it's over your nose and your mouth, completely covering both when you're outside your home, when you're anywhere that you're not with people that you do not live with. I ask you to wash your hands frequently for at least 20 seconds. Use hand sanitizer if you can't wash your hands. And also to keep that 6-foot distance between you and other people, again, that you don't live with. And if we all do these things, then we will all be safer and we will all get through this pandemic together. So in the meantime, try to stay close to home, have more of a staycation, Stay safe by following all the guidelines. And as always, please stay calm during this pandemic and have a wonderful 4th of July weekend. Thank you.
You've been watching today's update on COVID-19 from Erie County Executive Kathy Dahlkemper. In case you just joined us, just a few notes before we get you back to programming. The county executive saying there are 12 new cases in Erie County in the past 24 hours. There are now 113 active cases. 11,676 people have tested negative, though, and the breakdown demographically looks like this right now. 58% of Erie County's cases are female, 42% are male. 49% of the COVID-19 patients are white, 35% are black, 4% are Asian, 2% other, and 10% of the patients are classified as unknown. Now, as we head into the 4th of July holiday weekend, the county executive and the director of the health department, Melissa Lyon, who was part of today's briefing, both saying over and over again that really the best thing to do is to wear the mask and social distance. In fact, at one point, Kathy Dahlkemper saying, when she talked about the 4th of July weekend, do your, quote, patriotic duty and wear the mask. One note from Melissa Lyon. An optimistic note from the health department. She said that, you know, we're about 10 days out from Father's Day, and the health department has not seen a spike in the number of COVID-19 cases that may be attributed to family gatherings or other social gatherings during the Father's Day holiday. So that was good news from the health department and from the county executive. All right, let's take a closer look at the numbers now. As of this afternoon, confirmed cases near us in Erie County, I told you 12 new cases. The total is now 620 with 14 deaths reported. Crawford County is reporting 57 cases. Warren County now has 7 cases. There are 131 cases in Chautauqua County, New York, 7 deaths reported there. And 421 confirmed cases in Ashtabula County, Ohio, with 43 deaths reported in Ashtabula. Across Pennsylvania, more than 87,000 positive cases of COVID-19 identified so far. More than 87,000, that's 636 new cases. We can tell you that almost 6,700 people have died in Pennsylvania, but more than 689,000 people have tested negative. All right, best advice, as always, we've been saying it for months now. Stay calm, stay home, wash your hands often. Still, wash your hands and practice the social distancing of at least 6 feet, and of course, wear a mask. We'll have a complete wrap-up tonight on Jet 24 beginning at 5 o'clock. Thank you for joining us this afternoon. I'm Sean Lafferty. We'll see you at 5. Good afternoon.